Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Line Health. Here's Jessica Boyington.
Stroke is a leading cause of death in the United States, but your chances of surviving a stroke greatly improve when you know how to recognize the warning signs and take steps to lower your risk of having one. Survival often hinges on a combination of how quickly treatment is administered and the type of intervention that's available. Paoli Hospital, part of Line Health, is celebrating the one-year anniversary of their state-of-the-art neurointervention lab. The lab has brought leading-edge capabilities to Paoli Hospital, enabling Line Health's team of experts to provide advanced stroke treatment to the western suburbs. These capabilities are also offered at Bryn Mawr Hospital. We're here today with Dr. Sumeet Multani, vascular neurologist, neurointerventionalist, and site director of neurointervention for Paoli Hospital. He's going to talk to us about how the experienced team at Line Health-Jefferson Neurosurgery is using the latest technology to help save the lives of those who experience a stroke or neuroemergency. Dr. Multani, thanks so much for being here with us today.
Thank you so much, Jessica, for having me.
Well, so you definitely just had a really busy year because Paoli Hospital is celebrating the one-year anniversary. I'm sure you've been busy. Why is this significant for Chester County residents?
Our communities in the past were traveling far away in downtown Philadelphia area to get the same basic treatment, sometimes life-saving treatment. So having the Paoli Hospital neurointervention program, it's really life-changing for our communities where they can come in and quickly can get treated for some of these emergency situations where we can take the clot out.
Tell us exactly what neurointervention is and how can it help stroke patients?
So neurointervention is like a field, a very specialized branch of neurovascular or neurosurgery, where we can navigate very small, like 1 to 2 inches of or even smaller microcatheters into someone's brain and basically navigate some catheter to take the clot out, put the stents in the brain. Sometimes if you have ballooning of your artery, like aneurysm, we can take care of that. Patients recover within 24 hours. So this is minimal invasive surgeries.
Well, we're hearing of some of these advancements in the field of neuroscience and of course for stroke care as well. How has Line Health embraced this new technology and all of these advancements?
Yeah, so I think it's very important for any health institution and any specialized branch to evolve with time. Not only like having the new catheters and new devices, we are using a specialized artificial intelligence technology called VizAI, which basically alerts any of our neurosurgeons directly on their wristwatches, Apple or your phones. You get like alerts of any patient coming into the ER with a clot in their brain or the hemorrhage. We get like within seconds a notification and we can mobilize the team.
I'm sure anybody watching this too also has this question. What can people do to lower the risk of having a stroke at all?
Number one, your healthy diet. Just having a healthy lifestyle and making sure your blood pressure, your diabetes, your smoking is well controlled, your heart is healthy. So I think these basic things can really help you reduce the risk of strokes.
So we just talked about reducing the risk of having a stroke, but if you're already past that point and you potentially are in line of having one, what are some of those symptoms that people need to look for?
Anyone having face weakness, speech issues, arm weakness, trouble vision, walking issues, just call 911. I always say don't hesitate if you think someone is having a stroke. So as soon as you come to the ER, we're already ready to take care of you.
Why do you think that Line Health is one of those leaders in that stroke care?
We are keeping up with the technological aspect of neurovascular disease, but also we have very specialized people who can take care of that. Most of these patients end up requiring some rehab. So we have a very good relationship with our rehab facilities nearby us. So it's like a whole team effort. And I think with Line, we have covered each and every part of this.
You know what, Dr. Multani, I want to thank you so much for being here with us today. I really feel like having a stroke kind of hits home to a lot of people, whether it's someone they know or themselves. So thank you so much for sharing this information with us.
Well, thank you so much, Jessica. It's always a pleasure talking to you.
To learn more, you can visit mainlinehealth.org/WellAheadPhilly. Thanks so much for watching and have a great rest of your week.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Line Health.